You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Sara Nashi, how are you?
Good. How are you?
Good. Thank you for coming over to the podcast. Let's tell the audience a little bit about yourself. Like, how do you start? How did you start? What are you doing now? And, what are your goals?
Yeah, so I started as physical medicine and rehab and physiatry. And as I progressed through that, I really felt a sense and a passion for interventional pain, kind of bringing hope to the hopeless. People that suffer from chronic pain often are at the end of their rope. They've tried everything. They've seen multiple physicians, and it's pretty much they're told they're going to live with what they have. And so, providing some outlet, some treatment, some functional plan for them to become well mentally, physically, emotionally again is something that I'm really passionate about.
Very nice. Yeah, it's so did you build up a practice about that, or are you part of a group right now?
Yeah, I'm part of a hospital system, and I actually am kind of, I guess, an outlier in that the first place I joined, I haven't left. And so I did my residency and fellowship at Wayne State in Michigan, and then I moved kind of back home to Cincinnati, Ohio. My family's here, and the hospital system I work for, I was kind of the first fellowship, board certified, pain interventionalist for that hospital system. And so grew the program over the 13 years I've been here. And so now we have three other physicians, and we have quite a few 7 APPs, and kind of a thriving division, soon to be a department. So it's been a great learning experience for me. I'm very blessed to have people who are passionate and like-minded to work with. So it's been really good.
Very nice.
Yeah.
So tell us a little bit about the difference between the interventional pain medicine and the pain management specialty. So what would you say are the main differences, if there is any?
Yeah. I think they complement one another. There's certainly a place for pain medication to be utilized. I think how we have seen from research and studies, chronic opioid therapy isn't as effective as we once thought it was. And so we have alternative therapies and interventions kind of shifting our mindset to more improved functional outcomes. And in addition to, I kind of use opioids as an adjunct to help with that. This is outside of, palliative cancer related type pain, but there is a time and a place. But I think traditionally, when you think, 20 years ago, pain management, you think more medication based office practices. Now, I think the fellows coming out are really getting multidisciplinary, interventional, hands on, therapies that they can offer patients for treatment options. And so it really is just expanding rapidly the ability to improve function and restore mental and physical health for people.
Yeah, I got it. It's like you said, it's very often that people go to the offices of pain management doctors and they end up with like, the desired prescription, I would say. Um, how would you how would you control this kind of trend, I would say, for patients that most of the time they have a very good reason for their pain and especially back pain. But there are a lot of frequent flyers out there that we know about that are showing up in this kind of clinics and offices. And I'm sure you deal with them a lot in your practice. How do you manage
Yeah.
that?
Yeah, so I think it's about meeting the patient where they're at, and having the conversation of setting expectations on what are their goals. I think I focus on what are goals, specific goals, and more than I just want to be out of pain, right? So we narrow it down. Well, what part of your pain, your ankle, your wrist, your knee, your back, you want to be able to do what? You want to be able to unload the dishwasher. You want to be able to walk to the mailbox. Like some tangible things and steps to do that. And then also educating patients on, chronic opioid use, what it does to our adrenal axis, our hypothalamic pituitary like systems, how it affects hormones, how it causes depression, what it does long term to our mental health, and how sometimes it can even make our pain worse. And so taking holidays, but I think you have to first establish a relationship, and you have to first understand, where is the patient? Are they in a, I don't know if you've heard of motivational interviewing, but there's kind of 5 phases. And are they in a phase where they are wanting to make a change? Or do they have a victim mentality of, this happened to me, and they're still stuck in that? And so kind of positive coping, kind of seeing where are they at in the spectrum of things with the disease process they have, and what do we have to offer. And so that's kind of how I start, kind of asking a bunch of questions, kind of gauging, and then educating and seeing if we can get aligned on how we want to reach our goals or the
I see.
patient's goals. Yeah.
Yeah.
And it can be
Um,
challenging, really challenging sometimes.
well, yeah, I think it's very challenging. I think it's one of those specialties that to be successful in it's very hard and it takes a lot of time. Um, Especially, because the specialty itself deals with a symptom that you guys treat, and you apply different methods to get rid of it. But the source of the issue is very rarely addressed by physicians in your specialty. How do you see this issue going? Because I think there are a lot of times where I've seen patients where they come in for procedures, for regular pain procedures, for a certain symptom, and they go on, 2, 3 times, 4 times, whatever, and it's a short-term effect, but the long-term issue is still there. How do you manage that?
Yeah. So there are treatment options. So, for instance, now we know there's vertebrogenic low back pain, and for that, we can ablate the basivertebral nerve, and that's a one-time procedure, and then it's done. I think getting to the core, there are some patients that may have short-term success with certain types of procedures, as you were mentioning, but then perhaps, there's spinal cord stimulation that might be a good option for them. So there are more long-term treatment options for patients who have tried the injections, if you will, or things like that, that don't get the sustained relief that we were, that we're all hoping for.
Hmm.
And those therapy options work really well for patients.
Yeah,
Yeah.
I see. Um, I want to go back a little bit to your personal approach to this path that you took. You know, it's important for the motivation of a physician for the long-term career to have something that keeps him going. Um, in your case, was there anything that happened in your life or professional career that kind of didn't work out at all for you, and kind of, you took a step back, you thought about it, and you move forward in a different way? Can you give us an example of anything like that?
Um, so I think being a female in medicine or a female in the interventional pain space has its own unique challenges. Um, I I have had a lot of personal struggles, not so much in my professional career, but getting to where I am wasn't easy.
Yeah.
So I come from a family of no physicians, and so I kind of paved the way um, as the first in my family to be a physician. And so to get to there, it's working 2 jobs. It's very little sleep. It's feeling like you have this calling to help people when you see in their eyes the sadness and the desperation. And I worked at a nursing home, moonlighting before I went into interventional pain, and you see those people and that are just there that maybe don't have loved ones and have a frozen shoulder or haven't been moved out of bed. And it's definitely a calling that you have on your life. You feel like it's a sense of what the Lord has called me to and to encourage other people. And so through my personal journey and overcoming um, some things that being told I couldn't do things that I was never going to be anything, those types of mental barriers that you work through and you realize that those are lies, that's not my identity. Um, and lead me and give me, fuel me into trying to share that with the patients that come through my door. And I found recently, maybe in the last year, that a lot of patients who come through my door now are I hear more often, I guess, this is not what I thought pain management was. I was so scared to come here. I was hesitant to come here because I didn't want pills. And I hear that a lot, so much so that I don't know if you know, but I've started to try to build some social media to just bring education and awareness that like what are pain diagnoses, what is pain management, what is interventional pain, what do we do as physicians, and to help it to not be so intimidating for perhaps someone that is afraid to come see an interventional pain specialist, that perhaps we could help and improve their quality of life in some way, where they have been told like there's nothing else I can do for you, because sometimes there is, you know. So
Yeah, this is very important. I think you reached a very good point here. And in terms of education, I think it's very important for people to understand that this type of procedures have a very limited knowledge in the general population. People
yeah.
don't know why we're doing what you're doing, and if you have any other choice or options or anything like that. So I think education is very important to give, a sense of meaning of those kind of procedures. It happened many times in in my practice. I'm an anesthesiologist. I've seen this a lot happening, is that patients come in for pain management injections in a clinic or in a center, and it's just a drive-through. It's just something, 5, 10 minutes procedures, boom, 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 get them done. And patients most of the time have no idea why this is done to him. What's the reason? There's no explanation. People get confused about what to expect and all this stuff, just because it's a procedure-based specialty most of the time. Is there anything in your practice right now that it's forefront? Are you guys doing anything new? Anything, that's very trendy, I would say, recently?
Well, because I work for a hospital system, we don't do a lot of the regenerative therapies that some people are now starting to do. I
Mhm.
do enjoy, speaking and teaching. So I think that there is a subsection of interventional pain physicians that are trending towards the stem cell PRP. PRP's been around, but more stem cell regenerative therapies in the spine. I have not done any of that. Um, we, I mean, the latest interventional procedures, which would be like the basivertebral nerve ablation, the posterior SI fusion with Globus, or these different companies that have the tines that, or the allograft that potentially fuses it. That's kind of a very controversial, hot topic right now. Um, but we do those things, the traditional spinal cord stimulation. I think the biggest thing that our practice does well is listen to patients. And I just heard this morning from a lady, I don't take for granted that you're my doctor, because I've been places where I'm not seen and I'm not heard, and you just took 15 minutes and listened to all my concerns. So I think while it's not very flashy or, trendy, I think that that's something that I feel like we do well, where I practice and where I work. And then the trends come and the trends go, but you want sustainable, you want treatments that are going to be effective and last. And stem cell might be something like that. And we just have to kind of watch, wait, and see. But those patients that I feel like could be candidates for those more nuanced procedures, I have relationships with my partners in the community, and I certainly refer them to them.
Yeah, yeah, it's a good. There's some good statistics and research out there right now about this thing, and it's very promising.
Yes. Yeah, it's very exciting.
Now, um, you know, you are in a hospital system. Do you think there is any difference between you practicing in that kind of environment versus being on a private office, private center, private clinic?
Yeah, absolutely. There's pros and there's cons. I think, when it comes to, I guess, the business of medicine, right? When you come
Hmm.
to like contracts with payers, you have, more leverage, I guess, if you will, for those types of contracts when you're with a hospital system than when you are with private practice. But on the flip side, with private practice, you can develop your fee for service type system. You can certainly choose to do regenerative therapies and the more nuanced procedures. I have several colleagues in the community who do that just do cash pay. They set up a cash based system. And so we have some limitations, and it would be certainly more challenging to do that with a hospital system. And some things, you know, we just can't do at a
Yeah.
hospital system. So yeah, so there are definitely differences, but there is more. Sometimes there's more safety built in working for a hospital system than a private practice because doctors do have to abide by certain standards and certain quality metrics. So, yeah.
Yeah, that's a big difference there. Um, would you like to practice in a private setting at this point to jump ship?
No, I guess I'm open to all things, right? I would not just immediately say no. However, like I have worked really hard to build the group I have. I really love my administration that I'm at. I love my partners. I enjoy my nursing staff now. I have a great team, and so you probably know who you work with really is uh,
Yes.
can make or break your day. And so I am very blessed to have an amazing team right now. So it would be really hard to pull me away.
Yeah, yeah.
Yeah.
No, I totally understand that.
Yeah.
Indeed, especially in this specialty where you deal with patients that are coming to you in sometimes in their last option, to do something about their pain or their, chronic disease. It's very important to be a good team
Yes.
for them. But
Yeah.
so tell me, is there anything that you would do differently if you look back when you started with what you know right now?
Mm. Oh, with what I know right now, I might build like a whole wellness center, maybe.
Oh,
If I could do like if I could have the knowledge of how the business of medicine works and just how everything runs, I might just go for it. Yeah, I
very
might do.
interesting.
Yeah.
How would you do it?
I don't know.
What would you incorporate in that wellness center?
Um, yeah, a lot of things. I mean, it would be phenomenal. It'd be awesome. Yeah. But it
That's
would be a
amazing.
lot of work. But
Yes.
I think if I went back, 13 years and my younger self, that I could probably do that. Maybe I'll help one of my kids do that. Who knows?
Yeah, yeah, absolutely. And
Yeah.
I think it's a great idea. I've seen a lot of people doing this recently, and they're very successful because I think the medicine is shifting their perspective towards more of a, I would say, comprehensive look at body as a unit rather than
Hmm.
specific systems and parts of it. And I think functional medicine is something that it gets a lot of traction right now because of that. And
Yeah.
I think a wellness center, it's a great idea. Maybe we'll circle back with you later on to see
Yeah.
where you are.
Yeah. That would
Um,
be good. Yeah. My kid's
how
right.
can
Yeah.
people know more about your educational stuff and your lectures and your things that
Yeah,
you teach?
so on TikTok, I'm Sara Nashi MD. I also have YouTube, Sara Nashi MD, and my Instagram. It's all Sara Nashi MD. My lectures, that's a good idea. I should maybe upload some of my, I spoke at Aspen, ASIP, OSIP. I'm on the board for WIPM, which is the Women Innovators in Pain Management. It's a society for women that are interventional pain. And then I am faculty for some industry companies. So I teach fellows some of the more advanced procedures and stuff. And I really, really enjoy that because they're, very hungry to learn and
Yeah.
very excited, fresh, enthusiastic. So it's really, really nice.
Very good.
Yeah, yeah.
Excellent.
So yeah.
Well, thank you so much for being here. I think this is a snippet of what people should look into, your work and maybe your educational points about this specialty. And I hope you don't forget that idea with the wellness center.
Oh, thank you. Yeah, I it's always in the back of my mind, but right now I just really enjoy what I do, and my kids are at such fun ages. So I think to do it how I would want would be too time consuming right now.
Yeah, yeah.
Yeah, yeah,
Well, good
yep.
luck, and I hope people will reach out to you for more
Yeah,
more
thank you
learning
so much.
experiences.
This has been fun.
Thank you.
All right, take care.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.